The authorities here say practice social distancing to reduce the spread of COVID-19. But for many living in the squatter areas of the Philippine capital, it isn't an option. This is one of the world's most densely populated cities. And now that there have been confirmed local transmission cases of COVID-19, there's fear that busy areas like this could accelerate the spread of the virus. The nearby San Lazaro Public Hospital is one of the country's front lines against the outbreak. It was here that the first COVID-19 death outside of China happened, and where many other confirmed cases are now being treated. But a well-placed source inside the hospital says staff are already struggling to cope. Speaking to the BBC on the condition of anonymity, the worker told us that the hospital doesn't have any COVID-19 testing kits of its own, and that with a limited number of isolation rooms, the hospital would be easily overwhelmed if there were a spike in cases.
Some of us might get infected, and we might run out of the people who can take care of other people who test positive.
According to our source, the hospital has a maximum capacity to handle around 40 coronavirus patients at any one time. We contacted the Department of Health, but they were unavailable for comment. At Ateneo Medical School, soon-to-be graduates are readying themselves to join the fight against the COVID-19 pandemic. This class has been taught by Manuel Deirit. He was the Philippines Secretary of Health during the SARS outbreak of 2003. He warns that if COVID-19 cases rise in line with countries like Italy, Manila's hospitals could be incapacitated.
I think what's going to happen is that many of these patients are not going to be able to be admitted in the hospital. And they will probably be critically ill, maybe in their houses. I think what happened in Wuhan, although it's not very well publicized, is that when their hospitals couldn't accommodate many of these patients actually died wherever they were.
The regional head of the World Health Organization is now urging other countries to show international solidarity.
We need the countries to come together to support those countries with limited capacity, so that they can also equally prepare for the large-scale community outbreak situation.
In a bid to slow